understanding what a kind of an epidemic it is and unaddressed in our society, um, unsupported in research, and really kind of the practitioners that women post birth who have sexual pain go to are unequipped and unknowledgeable about the role scar tissue plays in their pelvic pain.
Hmm. Well, they're unschooled about arousal. So they can't possibly know, since they're not trained to understand what healthy pelvic function actually is, especially in the sexual arena for women. There's no awareness of what scar tissue could do to inhibit that
Mm,
healthy sexual function. So if you're not trained in the reality of engorgement and lubrication, and all of the erectile tissue beds that get affected
mm,
by scar tissue as a result of episiotomy, even C-section, certainly tearing,
mm,
um, and prolapse and rectocele, cystocele. You know, those are all the different kinds of prolapses that can happen, uh,
mhm,
all of which will affect sexual function. But if
mhm,
you're not schooled in sexual function and you're only schooled in pathology, and you're busy creating surgical procedures to address pathology, and we know that's necessary. If you have, you know, cervical cancer, you would want somebody who knows how to address that surgically, for sure. But in the process of that surgery, there are follow-on effects from the scar that could inhibit sexual function. And without remediation of the scar, sexual function can be forever lost, and it need not be, because scar tissue can be remediated. The notion of remediation of scar tissue from a holistic perspective, in other words, not cutting out the scar, which is what often happens. People say, well, this scar tissue is a problem, let's just remove it surgically. Well, what does that do? That produces more scar tissue.
right.
A holistic remediation with hands-on work. This was a new idea, and this is what Dr. Medici was teaching us to do as shiatsu therapists at
Mhm,
the school. He was saying, when you find a scar in someone's body, this is how you work with it. You apply castor oil, you cross-fiber the tissue, you make it more resilient, more flexible, you increase fluid flow, increase blood delivery to the area around the scar, increase lymphatic drainage from the area around the scar. So the scar then can have more normal physiologic behavior instead of less and less normal physiologic behavior, because scar tissue is dynamic. It doesn't just, once you're healed, the scar is there. No, the scar proliferates, and it continues to proliferate
right.
throughout the life of the body if inflammation is what's, if there's a strong inflammatory milieu under the skin.
Hmm. Hmm.